First of all, I would like to thank the organizing committee for inviting me to this presentation entitled Mediterranean Diet in the Prevention and Treatment of Diabetes in the context of the PREDIMED trial. As you know, diabetes is a big public health problem. More than 371 million people in the world have diabetes, and it is expected that by 2030, this will have risen to 500 million people in the world. The prevalence of type 2 diabetes is increasing in parallel to the obesity epidemics. Approximately 80% of type 2 diabetic individuals have between 45 and 64 years and are living in developing countries. Is a potent risk for cardiovascular disease, but also blindness, renal failure, and lower limb amputation, decreasing quality of life of individuals. Is responsible of approximately 5% of total mortality, and it is expected that in next 10 years, mortality by diabetes will increase by 50%. As you know, healthy lifestyle is a very important risk factor for diabetes. For example, physical inactivity, smoking, overweight or obesity, an unhealthy diet, or alcohol intake have been related to diabetes risk, and this has modulated by the genetic background of the individual. And here you can see one of the most important studies demonstrating that lifestyle is an important factor conditioning the risk of this disease. In this study in the Nurses' Health Study, in this study conducted by Frank Hugh in 2001, individuals with a healthy lifestyle, non-smokers, with a body mass index less than 25 kilograms per meter square, consuming moderate amounts of alcohol, doing 30 minutes per day moderate exercise, and at the highest 40% of a healthy diet score, had approximately 90% decreased risk of diabetes. And what is more important, 91% of incident cases of type 2 diabetes mellitus in the cohort have been attributable to the non-adherence to the healthy lifestyle. Here, I summarize the results of several epidemiological studies relating food, nutrients, or several dietary patterns to the risk of diabetes. As you can see in the first column, you have those studies relating food, nutrients, or dietary patterns to an increasing risk of diabetes, and here a decreased risk of diabetes. For example, with a moderate evidence from several prospective observational studies or meta-analysis, sugar-rich beverage, fruit juices, meat or unprocessed meat increase the risk of diabetes, or a diet rich in whole grains, coffee and tea, or low-fat milk and dairy products have been related to a decreased risk of diabetes. Also, there are other foods that have been related with reasonable evidence from some prospective observational studies or expert opinions. For example, hydrogenated oils and margarines and eggs, moderate alcohol consumption, fruits and vegetable pulses, nuts sold only in women, or saturated fatty acids, trans fatty acids, antioxidants, magnesium, and vitamin D. Probably several mechanisms are implicated in this increased risk of diabetes associated to food intake or nutrient intake. For example, a diet with low glycemic index, a diet rich in fiber, with monounsaturated or polyunsaturated fatty acids, magnesium, or antioxidants. This decreases the risk of inflammation or the oxidation process or the endothelial dysfunction, or on contrary, a diet with high glycemic index or a diet rich in saturated fatty acids or trans fatty acids increases the risk of inflammation or oxidation and insulin resistance on secretion and increasing the risk of diabetes. There are other possible nutrients that could be implicated in this risk of diabetes. This is a new one, the dietary phylloquinone that we have observed in our study in the Predimed, in the context of the Predimed cohort, that dietary phylloquinone intake is associated with a reduced risk of type 2 diabetes. There are several mechanicistic studies that have been related the phylloquinone with insulin resistance and with the risk of diabetes in two cohorts. In case of dietary patterns, diet with a high glycemic index or a Western dietary pattern have been associated with increased risk of diabetes with moderate evidence from several prospective observational studies and meta-analyses. And a low glycemic diet or a prudent diet have been associated to a decreased risk of diabetes. Also, the Mediterranean diet has been associated in several studies, in several epidemiological studies, to a decreased risk of diabetes. The Mediterranean diet rich in olive oil, used as a main culinary fat, with abundant vegetable products, whole cereals, with bread, pasta, and rice, whole, fresh vegetables and fruits, legumes, tree nuts, aromatic herbs and species, frequent intake of fish or shellfish, and a moderate consumption of wine with meals, and a low intake of meat and animal products, milk and milk products, and simple sugars. As you can see here, several studies have been related, an inverse association between adherence to the Mediterranean diet and diabetes. This is, for example, the GZ prevention study. This was the first conducted on patients with myocardial infarction. Or, for example, this one conducted in the SUN cohort of university graduates of the Navarra University. Here you can see another study, the INTERACT study, into the EPIC study, that they also have demonstrated an inverse relation between Mediterranean diet adherence and diabetes incidence, and also in the Greek cohort of the EPIC study, in this study of Antonia Trokopoulos, published in Diabetologia in 2013. Here you have another study, the MESA study. This is the only one that don't observe an association between Mediterranean diet adherence and diabetes incidence, but they have observed that higher a priori Mediterranean diet score was cross-sectionally associated with lower insulin levels among non-diabetic subjects. And finally, in the health professional follow-up study, they have compared the effect of several patterns, dietary patterns, in relation to the diabetes incidence, the healthy eating index, for example, or an alternative Mediterranean diet score, or the DICE score, and they observed that one standard deviation increase in the Mediterranean diet score was associated to a 9% lower risk of diabetes incidence. And this increase in the reduced risk of diabetes incidence was observed in the Mediterranean diet, but also in the DICE diet and other healthy pattern scores. Also, we have two epidemiological studies relating Mediterranean diet adherence and gestational diabetes. This is one of them, the NASOS Health Study 2. They compare three dietary patterns, and as you can see here, those at the highest quartile of adherence to the Mediterranean diet have 40% lower risk of type 2 diabetes. And this is the last one study that published this year in the European Journal of Clinical Nutrition, also an inverse association between Mediterranean diet adherence and gestational diabetes has been demonstrated. Also, there are several clinical trials in order to analyze if a healthy lifestyle is associated or not to diabetes. This is the most important clinical trials, the MOLMO study conducted in Sweden, this one conducted in China, the DPS in Finland, the Diabetes Prevention Program in the United States, and this other in Japan, in India. In these clinical trials, they compare the effect of a healthy lifestyle to a controlled diet in general. There are several comparisons, but as you can see here, the relative risk of diabetes incidence is higher. Is higher when people adopt a healthy lifestyle. And this is between 28 and this relative risk is between 28 and 63%. It's important to say that in all of these clinical trials, it's difficult to delimitate what is the responsible of this reduction in the incidence of diabetes. What is the adoption of a healthy lifestyle? Is the promotion of physical activity? Is the weight loss achieved during the trial that is the responsible of this decrease? So any study just was conducted in the past to delimitate if a healthy diet per se without body weight loss nor physical activity promotion have preventive effects on new onset diabetes in individuals at high cardiovascular risk. And this is one of the main objective of the PREDIMED trial. Is a secondary point of the PREDIMED trial. You know, the PREDIMED trial is conducted on individuals at high cardiovascular risk, free of cardiovascular disease at baseline. It's all people with type 2 diabetes or 3 or more cardiovascular risk factors: smoking, hypertension, high LDL cholesterol, low HDL cholesterol, with overweight or obesity, or a family history of premature cardiovascular disease. And these individuals are randomized to 3 intervention groups: two Mediterranean diets, one supplemented with virgin olive oil or nuts, and compared to a control group that we recommend to decrease the intake of fat of all origins, animal fat and vegetable fat. This study, as you know, has been conducted by several investigators in Spain, and the trial started in October 2003, terminated in July 2011, with a mean follow-up approximately 5 years. And as you can see, old people, half of the people with diabetes, 82% approximately with hypertension, and more than 90% with obesity or overweight. As you know, the primary endpoint of the PREDIMED trial comprised cardiovascular death, myocardial infarction or stroke, but also there are several secondary endpoints such as total mortality, heart failure, major cancers, dementia, Parkinson, and diabetes. Also, we have ascertained intermediate outcomes, and I would like to show you especially those intermediate outcomes related to diabetes, especially fasting, blood glucose, insulin resistance, and inflammation. As you know, the main focus of the PREDIMED intervention is to introduce changes in the overall pattern of food pattern, more than to change the energy content of the diet or to change the nutrient intake. And in both Mediterranean diet groups, we advise to consume total fat ad libitum, olive oil as a main culinary fat, abundant vegetable products such as cereals, fresh vegetables and fruits, legumes, tree nuts, aromatic herbs and spices, frequent intake of fish and shellfish, a moderate consumption of wine with meals, and a low intake of meat and processed meat, milk and milk products, and simple sugars such as beverages, etc. And in the control group, we advise to the participants to reduce every type of fat of animal origin, but also vegetable origin. The dietitians did not recommend during the study any energy restriction or change in physical activity, and this is important for the study. One of the most important tools that we use in the PREDIMED trial is this 40-point score, measuring the adherence to the Mediterranean diet. It's not only a score in order to measure the adherence, but also is a tool for the dietitians in order to change the diet. No? At baseline, at every 3 months during the follow-up of the study, dietitians provide personalized advice to participants in the 2 Mediterranean diet groups based on this score that has been validated after 3 years of the trial. This has been published in Annals of Internal Medicine and also in the last paper in New England Journal of Medicine. The PREDIMED dietitians are directly responsible of the dietary intervention, and they adopt several strategies for behavioral change with quarterly individual contacts, group sessions every 3 months in order to introduce these changes in the food pattern with the provision of written information with seasonal buy-in lists, Mediterranean menus and recipes, giving self-monitoring tools, etc. And we give for free for all the participants, in case of the virgin olive oil group, 1 liter per week of virgin olive oil, and in the case of the nuts group, we give a mixture of walnuts, almonds, and hazelnuts. Here you can see the results of the pilot study after 3 months of intervention in the first 700 subjects randomized to the trial. I show you only the results in relation to these intermediate outcomes related to diabetes, the changes in HOMA. As you can see, we have observed a decrease in the insulin resistance measured by this HOMA index in those individuals without diabetes at baseline in comparison to the control group. And we have also demonstrated a decrease in several inflammatory markers, peripheral inflammatory markers, and also endothelial markers, such as, for example, CRP protein or IL-6. Probably these are mediators of this reduction in the insulin resistance that we have observed in this pilot study. Also, we have analyzed during the first year of follow-up of the first randomized individuals, 1,400 individuals, what it happens in the prevalence of the metabolic syndrome. And as you can see, we have demonstrated that observed a decrease in the prevalence of metabolic syndrome in the 3 groups, but this decrease was significant in case of the individuals that have been randomized to the Mediterranean diet group supplemented with nuts. And especially we have observed by the reversion of this metabolic syndrome, especially because we have observed a decrease in the white circumference and the triglycerides, in peripheral triglycerides in blood. This is important because these changes are observed without changes on body weight between the 3 groups of intervention. So these changes probably could be due for these changes that we have adopted during the trial. Also, we have published in 2011 in Diabetes Care the results in relation to the diabetes incidence. In our group, in Reus, we have randomized 870 people. Every year, we conduct a glucose tolerance test to all the individuals in order to ascertain diabetes. And as you can see, we have observed a lower incidence of diabetes in the control group compared to both Mediterranean diet groups. Here you can see the cumulative incidence. And here you can see the cumulative diabetes-free survival, the incidence of diabetes in the three groups. Here you have the control group, and here both Mediterranean diet groups. We have observed a reduction of 52% reduction of the incidence of new cases of diabetes during the follow-up, with no differences on weight changes between interventions. And now, in January of this year, we have published the final results in relation to the diabetes incidence in all the cohort. And as you can see, we have observed a greater cumulative incidence in the control group compared to both Mediterranean diet groups. Here you can see the cumulative diabetes incidence by group. And here you can see the virgin olive oil group, the nuts group, and the control group. After 1 year, you can see that there are differences, and these are differences. They are significant in case of when we compare both Mediterranean diet groups to the control group, with a protection approximately of 30%. 40% in case of the virgin olive oil group, and approximately 80%, but not significant in this case, in the Mediterranean diet group supplemented with nuts. Also, we have analyzed if those individuals that adhere more to the Mediterranean diet, irrespectively of the group, have more protection from diabetes, and we have demonstrated this, that those individuals that adhere more to the Mediterranean diet has more protection in case of diabetes. And the second question, because it's the title of my presentation, is the Mediterranean diet a healthy pattern useful in the control of diabetes? This is another question. In fact, there are only 5 clinical trials analyzing the effect of Mediterranean diet on the control of diabetes. I think the most important studies these are the SHI study published in New England Journal of Medicine in 2008, but this another important studies is the Esposito study published in Annals of Internal Medicine. In these clinical trials, they compare the effect of a Mediterranean diet to other food patterns, for example, or usual care, or a low-fat diet, a low-carbohydrate diet in case of this study, or a low-fat diet, or the American Diabetes Association recommendation diet. And in all of these studies, they observed that a Mediterranean diet compared to these other patterns are better in order to control diabetes as measured by the glycated hemoglobin. In case of this study, in the New England Journal of Medicine, the SHI study, in this study, only people with type 2 diabetes, the type 2 diabetes participants have this advantage of the Mediterranean diet compared to the other dietary patterns. This is one of the most important studies, is the Catherine Esposito study published in Annals of Internal Medicine. And in this study, they compare the effect of a Mediterranean diet to a low-fat diet. And as you can see, compared to those allocated to the low-fat diet, a greater number of newly diagnosed diabetes participants in the Mediterranean diet group met the glycated hemoglobin goals at the end of the trial. And they also analyzed the people, the medication, what happened on the medication, the anti-hyperglycemic drugs therapy during the trial. And as you can see here, you can see the probability of remaining free of treatment. And as you can see, this was better for the group randomized to the Mediterranean diet. it's important to say that in all of these studies, people that has been randomized to the Mediterranean diet lose more weight, and probably is for this the results could be explained by this and not for the healthy pattern per se. And this is the last slide. Is a meta-analysis published in American Journal of Clinical Nutrition recently, and they compared several dietary patterns: low carbohydrate diet, vegetarian diets, vegan diets, low glycemic index diet, high fiber diets, Mediterranean diets, etc., with low fat diets, high glycemic index diets, the American Diabetes Association diets, or the European Association diets for a study of diabetes, or low protein diets. And the conclusion of this meta-analysis is that low carbohydrate and Mediterranean diets led to a greater weight loss, but also that Mediterranean diet led to a better control of diabetes. So we have some evidences that Mediterranean diet could be beneficial for the treatment of diabetes. So, in conclusion, in relation to diabetes prevention, and non-energy restricted Mediterranean diet enriched in this extra virgin olive oil that is rich in monounsaturated fatty acids, or tree nuts that are rich in monounsaturated and polyunsaturated fatty acids, but also several phytochemicals and other important molecules with several functions, can be useful for decreasing insulin resistance, improving oxidation and inflammation, and preventing metabolic syndrome and diabetes without changes in weight gain. And in relation to diabetes control, in type 2 diabetic individuals, a hypocaloric Mediterranean diet could be a useful tool in the context of diabetes control and to reduce the amount of use of hypoglycemic therapy. So the Mediterranean diet is composed by several foods that by different mechanisms can be beneficial in order to prevent and to treat diabetes and to prevent cardiovascular disease. Thank you very much.